So when we sign into Empathia on the web version, we'll be sent right to our home page. From here is where you can start a new encounter. So you can either just the blue button with the plus sign, click it, and you can just start recording. You can put a patient's name here up at the top, Lily. You can also put initials if that you feel more comfortable doing that. You can put the pronouns, and you can put the type of visit it is. You can also select a template that's applicable. So if we wanted to have a primary or a secondary, or if we wanted just a general ER note, we could select the note that's appropriate. If we have any context that's relevant, we can put it in here. So any observations, any labs, any results, any impressions, we can copy and paste previous notes in here from the EMR. We can also take photos or upload documents from here. So we have PDFs. So if we clicked on this, we can actually upload some photos that we have. So if we had an X-ray, we could upload it here. Or if we wanted to capture a screen or the web, we could select the window from here. Those would all be pulled into the note. If we know that we wanted a consult letter or a patient handout, we could also click it here. And we could just start recording by clicking the blue button, or we could dictate from here. If we were just prepping to see the patient and we weren't ready to record, we can also save this as draft. So that's one of the versions that we could do when we are seeing a patient. Now, we talked briefly about the templates. And so I know for ER physicians, it's really important to have the appropriate template. So if we go into the side where the personalization is over here, we can go down to template. We have personal and community. So community is some templates that ER physicians or Empathia has put on the platform for you to be able to take. Now, if you are seeing somebody that you can also select your specialty here, but when you signed up for Empathia, you selected your specialty, so it should be at the top. You can search to see if there's an appropriate note here. So if you wanted an emergency medicine consultation, you can select that by going over here and importing as mine. You can see all of the information here, the type of note it is, and then the information that's going to be provided. You can edit each section, you can rename them, but if it looks pretty good to you, you can save it to your personal folder. Once you save it to your personal folder, you'll be taken to personal. And these are all the templates that you've selected, so apply to you. So when you're selecting a template later on, when you're doing a note, it's easy. You just see what you want to see and what you want to select from. If the note was pretty good, but you wanted to refine it a little bit more to sound more like you, your personal preferences, you can go in here. And if you wanted to rename it ER instead of emergency medicine, anything that you'd like, you can name it here. If you scroll down, you can see that you can tag it and you can modify. So you can edit each section where appropriate. If you decided you didn't want social history, you can completely remove a section altogether, or you can add a section. So really customizable for you. You can also select an encounter to see what the note looks like when applied to your patient. So that's a little bit about the templates and how to edit them. If you find yourself using the same template over and over, you're more than welcome to turn on default. This means that every time we open a new encounter over here, it's automatically going to default to always be our preferred template. Now, that doesn't mean that it's stuck there all the time. So if you have it as your default, because 90% of the time you're using that template, you can simply just X out of the template and reselect another one. So if we just wanted to have, this emerge consult, then we can do that too. There's also in the templates, you not only can edit it that way, but you can also use Smart Edit here and really tell the note, I want this to be more concise. I would like bullet points instead of dashes in these sections. So you can really customize it using the Smart Edit. So I'm going to pause for a moment and see if there's any questions that anyone has right now. Feel free to put the questions in the chat as well. Okay. So I also wanted to talk about preferences. So we briefly just went right to templates, but in your personal preferences, if you wanted just a SOAP note rather than a template, you can go in and modify the SOAP notes to be the style that you prefer. So for instance, if we wanted a default, you can see along the side the example of the default note. You can see that we have a simple SOAP. So there's all different ways that you can customize these SOAP notes or multiple SOAPs. So if there is multiple issues, it will be a SOAP note within. You can also select the length. So having a brief note, concise, and then you can go up to highly detailed. You'll always see along the side what the note will look like. And you can also reorder it if you want to. You can also remove subsections. So if you really liked this multiple SOAP, but you wanted to remove social history, say, you can also remove that as well. You can toggle on lots of different areas. So if you wanted to hide differential diagnosis, you can, or you can show it, patient consent, empty sections, you can also hide. So if you, didn't want to have a certain section and you left it blank, it won't say NA, it will be hidden. You can also include the duration of the visit. So lots of preferences here. And if you go into note settings, again, you'll see that there's lots of different customizations that you can make. Dictation here, you can select verbatim or structured. Verbatim will be exactly what you're saying. Structured cleans it up a little bit and formulates it, the AI, with periods, punctuation. So no need to include that into your dictation.
Melissa, we got a question from someone in the chat.
Okay.
The question says, at ER, sometimes histories are obtained from the patient, relative, friends, or paramedic. Is it possible to record history from the patient, family members at the same time?
Absolutely. So if you go into encounter here, you can start recording and you can record all of that information.
Right. And if the information trickles in maybe at a different time for ER physicians, specifically if you have your specialty set as ER, you would be able to add something called section dictation, and that would be added with a timestamp onto the note. I think Melissa can demonstrate it for you by
Yes,
clicking on add recording. Yeah, okay.
we can add recording from here. So there's two different ways. We can do it from the app for on your phone, but we can also do it from within the web version. So we can click in here and you can either dictate into the note. So we can into the note, or you can start recording. Does that answer your question? Or we can dictate into the actual note itself.
I guess one quick point that I would like to add for, especially in the ER, is if you're talking to multiple people in the initial conversation, always address people by their name, or when you're first starting the conversation, say that I am gathering history from patients' uh, spouse whose name is such and such. So that helps the AI kind of identify the different speakers. And then it can combine the history, saying that this was gathered from a family member versus this was the subjective report of the patient versus this was the assessment that was noted by the physician who's doing the encounter. So if there are multiple people, if there are paramedics, if there are relatives that are present in the ER and the patient themselves is not able to report the history, just before you start the conversation, people always like to say, this is for the benefit of the AI. I'm just going to say that I am talking here with the patient's wife. I am talking here to the paramedics, such and such, so that that record is generated in the final note. But in terms of the recording function itself, there's nothing different that you would need to do. Just press start recording and speak to everybody as usual. Thanks, Melissa.
Thank you. Any other questions? I saw Dr. Jones had their hand up. No, okay. So when we, once we've completed a note, I'm going to go into one of our notes here. You can see that the note will be generated in a SOAP note here. We also have the summary as well. So this one was done without a template. You can see that if we wanted to modify, the pre-arrival, we could simply click into the note. We could add a section if we wanted here. We can even edit using the Smart Edit as we discussed before up here. And we could copy each section. If we wanted to modify the entire note, we could go into the edit here, edit all note, and then we can edit the note here. We could also add a dictation if we wanted to the note. We could also change the template as well if we wanted to here as well. When we're copying and pasting into our EMR, there's two, we can copy as plain text or we can copy all, and this will take the entire note. I know there's some EMRs that you have to copy and paste each section into it. So that's when you would use this copy here, and you can copy each section to the EMR. If we wanted to generate alternative notes, we can click up here to generate other notes. You can generate patient handouts. You can select a referral letter. I'm going to go ahead and select a referral letter right now. So say we wanted to send this patient somewhere, we could create our own template, similar to the templates we showed earlier, where you can select referral, if you wanted a sick note, and so on. So we'll select referral letter here, and the AI will generate the referral letter. I'll go back into templates and show you how you can create your own templates. If you wanted, there was one on your EMR or one that you're currently using that you really like. Once we see the referral letter. But that's the SOAP note, and then we have the summary. So this will be the summary of the entire visit. We have created the referral letter. So this is a trauma surgeon specialist. We have 3 specialists, so it generated 3 referral letters for this patient. And then if we wanted to see the entire transcript, we could go into the transcript and see. So I'm also going to click on the supplementary note. And then this is where you could, there's two ways you could generate a discharge summary from here, a sick note. But you can also, if you have set your ER, your Empathia as an emergency physician as your specialty, it will automatically generate a discharge summary for you. And again, you can create your own template for a discharge summary if you have a specific way or a specific preference for that. Again, if we wanted to create those templates, we would head over to personalization, templates again, and create your own template. This is where you can upload a file here. And, if you have one on hand, or you can copy and paste into this section here. You could also create one of your own. And here, this is the type of note style. So if you would, a draft summary, a supplementary note, a consult letter, referral, and so on. I'm going to pause right there. That was a lot, just to see if anybody had any questions before I go into what the mobile app looks like.
There is one question, again, from Dr. Sia, I think, about the copy-paste functionality. Yes, we had received feedback previously about the formatting not being maintained in Meditech. So what physicians were doing was they had to paste into M-Model, which would then insert it into Meditech, and the formatting was not being maintained. But that issue for SOAP notes has been resolved. We're working on a little bit of a bug for the consult and the supplementary notes, but SOAP notes can be copied directly to the M-Model interface to insert directly to Meditech. I believe Fraser Health is on the Meditech EMR. And Melissa, if you can just show specifically for Meditech, we recommend using the copy all button on the SOAP note.
Yes.
If you go.
So copy all, right? The two boxes.
Yeah. And a lot of physicians are kind of used to selecting the entire text and then right-clicking to paste. For the purposes of using this kind of separate separate AI scribes, please use the copy all functionality, because that helps us control the formatting more than the selecting the note to paste into the EMR. So yes, thank you for asking that question. That is definitely some feedback that we had received, and for the SOAP note, we had resolved that. But if you see any discrepancies, please let us know.
So I'm going to go into the phone app. I'm going to mirror my phone. So it's just going to take me a moment to, I'm going to stop sharing here and share my phone. Do most of you use the app on your phone if you're using Empathia right now? Okay. Sorry, it's just going to take a sec. Here we go. Okay, so when you're using your app on your phone and you want to start a new encounter, you just hit new encounter. And then you can select your template from here. If I had a patient that had chest pain, I could do that, select that. If I wanted to change to an ER consult, I could do that. So save the template you want to use. And you can simply start recording. If I wanted to pause for any reason, I could pause, or I could stop and save the progress. If I wanted to add another recording, I go into encounters, click on the patient, Up in the corner, you'll see the microphone. Little Emma in the side, the robot, we can select that. Sorry, we can also select photos. So if we had any photos of labs, we could take the photos here. If we had a picture of a wound, anything that you would like and you think would be relevant to your note, or you can select album and select from your camera roll if you've already taken those photos. So that's one way. If we wanted to add a dictation onto this, so we've assessed the patient, we've sent them for labs or some tests, and we want to come back because we received them and start the encounter again. We can also select add dictation, section dictation, sorry. And you can keep adding on to your visit. Every time you go in, you can keep adding on using your phone. And continue recording. The Empathia will keep adding on to these, and it will sync with the web version. Now you have to copy and paste the notes from the web version into the EMR that you're using. You can also just start dictating if you wanted to on a patient as well. Okay. I'm going to stop sharing there. Does anybody have any questions specifically about the phone app or anything right now?
Melissa, while you're on the phone, I also wanted, maybe you can quickly show the pause and resume functionality. Sometimes physicians are walking between different patients and may not have finished completing an encounter or a conversation. So just like you have up on your screen right now, the pause and then starting another recording.
So we can go into the encounter. We can pause this encounter. Oh, sorry. And then we can go into another encounter. Sorry, that one's complete. And start recording.
So I guess the difference in the two functionalities, the adding the section dictation versus the pause and resume functionality, is that the pause and resume is that you're still having the conversation and you want to go back to the patient. You just got distracted for a moment, so you just pause and then leave the room and walk over and record the next conversation versus the add a section dictation is more for you finish the initial assessment for the patient, you put in some requisition for labs or x-rays, and a couple of hours back you're coming and reviewing those notes, you do a reassessment, and based on that you plan for discharge or the next steps. So that's the way that we have designed the app to function specifically for the ER physician's workflow. Thanks, Melissa, for demonstrating that. There is a question from Dr. Lisa. Can Empathia replace the need for transcription services? The way that I usually would like to answer this question, and Michael, Melissa, you can also chime in, is that Empathia definitely does a lot more than just transcription. It adds the additional layer of the AI clinical support for summarizing documents, for synthesizing a lot of information that you capture from different sources, whether it is reports, whether it is conversations being summarized. So it's not just the dictation that needs to be replaced by Empathia. that's how I would respond. Feel free to add anything to that, Melissa and Michael.
No, I think that sums it up for me. That's what I would.
And also, when a lot of physicians used the dictation services, they have to pay attention to saying things like saying a sentence, saying period, or saying next paragraph, or highlight this. And that's taken away. That burden of trying to format the note as you are dictating it is taken away by Empathia. So you have the option both to capture whatever you're dictating either verbatim so that you just get the text of it, or you have the option to add structure to it, add a template and get it formatted into a nice, beautiful note, just as you would have typed it out maybe. So if an institution commits to Empathia, the cost of transcription could be replaced with the cost of Empathia. Yes, in theory, yes, the cost is definitely lower. We have found that a lot of clinics are actually not continuing with their transcription services because of all the additional functionalities that are available on Empathia, not just the transcription. So I'm not sure if uh, hospitals are exactly on board in terms of them paying for the functionality yet. But yes, that's the direction that we're heading in. And I see Michael was nodding. I'm wondering if he has any anecdotal um, evidence to add to that.
Yeah, I just wanted to add one extra point to what you said. In Empathia, with a transcription service, if someone has an unconventionally spelled name, it would be spelled however it's spelled within the transcription. But with Empathia, you would be able, if you spell it out in the conversation, the system would understand that this is the spelling, to go with, and it would fix it for you in the entire note.
Just along that thread, Melissa, if you are happening to switch back to your web, you can maybe demonstrate the different types of dictation modes, the verbatim versus the structured.
Yeah, so when as I previously showed you in personal settings, personalization, in note settings here, this is where you can select dictation style and verbatim. And we could demonstrate this. Hi, I'm working with Empathia today. We are running a webinar for emergency physicians. It's quite short, but you can see that it added in my punctuation. We can go into note settings and we'll change that to verbatim. Hi, my name is Melissa and I'm with Empathia today, running a webinar for emergency physicians. Well, it added a slight bit of punctuation today. So I'm going to pause because feel free to unmute and ask any questions as we go along. Okay. I'm going to briefly just go over patient privacy. In data management, you can select, the retention time. So if you know that you copy and paste your note into your EMR, and you wanted to have a specific time where all the notes are removed from Empathia, you can actually schedule that. I will say though, after the 30 days, we can't get any notes back. So just make sure that you are sure about the time frame that you set for here. You can also leave it blank if you'd like, whatever is your personal preference. In security, we do have two-factor setup. You can select that and enable it. We also have auto logout. So again, your personal preference or whatever the organization you work for, if they have specific rules around that. Patient consent, although we do have it in the notes, we do offer these printouts. So, you know, if you would like the concise, detailed, and verbal, or you could show them if they have any questions in and around Empathia. So we offer that to physicians as well. I'm not quite sure if you guys use any macros, but we do have macros. I'll quickly go over it because we do have some time left. You can, similar to the templates, we have personal and we have community. So in community, you can go through and select, similar to the templates, save as mine. If there is any that you'd like here, and then they'd end up in your personal. Here you could here edit them. So if you took one from the community, you wanted to edit it, so you know, change the quick key if you'd like, you could. If there's a bunch of macros on your EMR that you really like and you're using quite frequently, you can batch upload here. And you can also add new ones. So if you're coming across something that you're using quite frequently and you want to add it on to your Empathia, you can just add them one by one here as you go. You can use the macros within the note by when you do new encounter, you can add the macros in here. So if I was ordering labs and I didn't want to dictate it or write it, or I didn't talk about it with the patient, I can actually add that in later. And you can add as many as you'd like if there's several that apply. And then they'll appear in your note. Okay. Any questions? All right. So one thing we always like to highlight is down here, live chat. If you click that, you can actually chat with us through working hours. You can chat live. So if you're running into, I can't actually remember how to create a template, you can reach out to us here. You can schedule a call or a callback. We also have getting started with the waving hand. Over here, we have some a tutorial on how to get going, but we also, you can book a one-on-one support session as well. And we have onboarding tutorials here. So some of the stuff we went over today, you can find here.
Melissa, we got a question.
Oh, yeah.
About the to have Empathia in your cell phone to dictate anywhere in patient's consult room. How much would it cost? And if we can mention the PHSA discount being directly applied to accounts.
Yes. So that was a lot.
Sorry. It's basically cost and PHSA discount. Yeah.
Okay, perfect. So if you are part of the PHSA, you are given a significant discount. I think, Michael, is it 50% off?
Yeah, it comes out to about 50 a month. Yeah.
Okay, yeah, 50 a month. We also are running a holiday special where you also get 50% off your first subscription. But if you were looking at billing and plan, you can go into your settings and subscribe now, and it lays out what the plans are for you.
We got a follow-up question. Is there a group cost for an institution?
There is, yes, we do have group rates as well. And Pradima, do you think that they would reach out to us directly to talk about those,
Yep.
to see what the clinic size is or the organization size?
Yep, exactly. So based on the number of participants, the physicians in the clinic, whether it is physicians or nurses or assistants that need to be included in the clinic, that'll be based on that. There's another question. Thank you for asking that question, Dr. Suleiman, about the app recording when there is no internet connection. We do find that happen pretty often for maybe physicians in a hospital with poor connectivity or people working in rural and remote areas. It will continue to record even though the connection is lost. And yes, it will store the conversation locally. It will not generate a note, however, unless you have returned to a stable Wi-Fi connection. And within the app itself, it will show you instructions on how to do that. Like once you have reconnected to Wi-Fi, it will ask you to upload the transcript basically to generate the other to generate the notes. If you know that you're going to be in a location with spotty internet connectivity, we also recommend that you record completely in offline mode, so you can just have those transcripts and you can come back to the note generation piece whenever you are in stable internet connectivity. Do you have another webinar that I can send to my colleagues? It will, oh, the issue that I have is that it will not start the recording. So to record in offline mode, you on your app, or sorry, on your phone, you would just turn off your Wi-Fi, go to airplane mode, and then you can click start recording. So if you notice that the connectivity is patchy and it does not allow you to start recording, you can simply turn off your Wi-Fi or turn your phone into airplane mode.
There
So
was another question. Do you have another webinar that I can send to my colleagues?
We haven't scheduled an ER webinar yet. This one has been recorded, so all the participants will be receiving the link to the recording. But Dr. Allen, please feel free to reach out. We are happy to schedule a group onboarding or a training session for your team. Thank you. All right, I think we just made it right on time. Thank you, everybody. Thank you, Melissa, Michael, for hosting. Thank you, everyone, for taking the time this morning to attend and for your questions. We hope that this will help you streamline your recording and your practice in your day-to-day workflow. Thank you.
Thank you, everyone.
Thank you. Bye.
Bye-bye.